Violent incidents are on the rise in hospitals right across the country. Surrey Memorial Hospital in BC, for example, saw a nearly 10% increase in code white alerts in the first 7 months of this year. Now, code white is the term given when patients either become violent or they act out in a dangerous manner. Surrey Memorial is not alone. Joining us for a look at how widespread the problem is Adrienne Gear. She is the president of the BC Nurses Union. Thanks for getting up early for us this morning.
Yeah, no problem. Good morning.
You are tapped into nurses right across the province. What does the scale of violence that they're experiencing look like right now? Like when we're talking about violence, can you give me some examples of what they've experienced?
Sure. Well, nurses across the province are very concerned about experiencing violence, whether it's in acute care, community non-hospital settings, or even long-term care. My members report through a recent survey that on a monthly basis, 51% are exposed to physical violence, about 80% to verbal violence, and that's on a monthly basis. We also know from WorkSafe BC time loss claims that we've seen a 53% increase in the number of those types of claims over the past few years. And so very concerned. Nurses did not go into the profession to be harmed at work. They have the right to a safe workplace and want to go home at the end of their shift to their families free from harm.
My understanding is those numbers could even be higher because reporting doesn't even always happen because it's become so commonplace that nurses are just beginning to carry on with the rest of their day.
Well, it's becoming commonplace, but also employers do not follow up. And so for a nurse to continue to report violence and then your employer does nothing about it, like why would you continue to report? So definitely underreporting is a problem, but lack of action is actually the bigger problem.
We're going to take a look across the country. According to the results of a survey that was published back in March for the Canadian Federation of Nurses Union, it found 59% of respondents had experienced violence or abuse on the job just in that year. So I guess my question is, what's driving this?
Well, I think it can be a number of things. When I look at the context of what it's like to be a patient or a nurse in the hospital system right now, and I'm sure it's no different than, you know, other provinces. But in BC, when you look at an emergency room, I mean, it's a pressure cooker. People are waiting hours to be assessed and provided care. They're at their very worst. They're in pain, anxiety. Now, not that I'm excusing hauling off and beating up on a nurse, but certainly we know that when people get timely care, when they have accessible health care, when there's enough nurses to provide the care, the incidence of violence actually goes down. And that's not just a Canadian statistic. That is something that we know internationally. When you have enough staff, safe staffing levels, that in itself reduces the risk of violence.
Yeah, it is shocking to think about nurses, people in the line of care are actually in the line of fire when it comes to the frustration people are feeling with this broken healthcare system we're in. Police officers, here's an example. They're now stationed at Health Sciences Centre in Winnipeg. Surrey Memorial Hospital is also considering a weapons detection system. So what does a solution look like for you?
Well, certainly it's the BC Nurses Union has been advocating for the AI-assisted weapons detection. In fact, we've actually negotiated funding and we're willing to partner on a pilot. So we think that makes sense in some larger hospital spaces. In terms of like a hospital-type police force, again, maybe not something that we need to see in all healthcare facilities, but certainly in some of our larger centers, such as Surrey Memorial, Vancouver General Hospital would be another example. We think it's time to have this conversation and at least consider it. You know, we have relational security officers in many of our facilities, but we also have many facilities that do not have any provision of security whatsoever. And when you think about nursing in a more rural or remote area, there's nothing to protect nurses. And I think the other really important conversation that we need to start having, or at least acknowledging, is that, you know, while healthcare workers are becoming injured, like, what does that do for patients to witness their nurse being beaten? And in some instances, patients have gotten inadvertently caught up in the violence. And so, you know, healthcare spaces should be sanctuaries. People should not worry about being exposed to violence while either receiving care or providing care.
Adrienne Gear, president of the BC Nurses Union. Great to have you on the show, giving us a snapshot of what is happening from coast to coast to coast with nurses in hospitals. Thanks so much.
Thank you for having me.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.